continuing with our series on breast cancer, and today we're going to be talking about how is breast cancer diagnosed. Doctor?
Well, Counselor, the diagnosis of breast carcinoma is pretty straightforward and has been for some time. It's usually initiated when a lump is discovered on breast examination and a mammogram is ordered and it shows an abnormality. That pretty much commits someone to undergo further testing. And that testing tends to be invasive, with the exception of new MRI techniques that are being employed that may be able to, sometime in the near future, to obtain an accurate diagnosis without actually invading the body. Nonetheless, a number of techniques have been employed for years with great efficacy. These include ductal lavage, where a little bit of fluid is injected into the nipple and the fluid is extracted and sent off for analysis by a pathologist, much like a pap smear. It also includes fine needle biopsies, where a needle is introduced to the area where the lump may be and tissue is extracted. If that's not successful, larger needles or trocars are used, and this is called a core biopsy, and they may be required to get adequate tissue. In the absence of that, sometimes a lumpectomy will be performed, where a small incision will be made in the breast, and then the lumpy area will be at least sampled, if not totally removed. In the absence of that, many women are electing mastectomy. If it appears that they have a high risk for cancer, they decide to proceed with that. The goal in all these diagnostic modes is to obtain tissue, in every case except for the MRI, and to determine if that tissue is cancerous and what type it is.
Thank you, Doctor. If you or a loved one has received a breast cancer diagnosis and believe a medical error occurred, please feel free to call us at 770-518-1133 or visit us via the web at www.doverlawfirm.com. Thank you.